We're ready, okay. It's my pleasure this morning to introduce to you Dr. Vera Stejskal, immunotoxicologist from Stockholm, Sweden. She's employed at Astra, and she's been instrumental in developing the MELISA test, memory MELISA test for metals, for the allergy to metals. I'll let her fill in the areas that she wants to talk about on her CV, since we are trying to stretch things a little bit away, hopefully. But she will tell us today about our new testing and how far along she is in getting it implemented in the United States and in Europe. Vera, you want to come on up and get started? Vera Stejskal.
I better stay here.
Yeah, then you can just put that on. You have a pocket?
No, I don't have
Just
any
hold
pocket.
it.
I will hold it. Okay. Good morning, everybody. How do you feel? It's good, yeah? Great. Nice place. Well, thank you, Ed and Carol, his lovely wife, for inviting me. And I will introduce myself first. First of all, I would like to remember the day when I met Ed Arana. And it was some time ago. Ed is my friend since about 4 or 5 years. And it was in the meeting in Denver, Colorado. It was IABDM which invited me, Paul Rubin, who was the boss at that time. And the first evening when we came over there, I didn't know anybody, not a soul. So I went up for get-together, cocktail party. And the first person I ran into was Carol. And she started, hey, are you from Sweden? And what are you doing here? And so on and so on. So that's how it started, and it kept until now. And they visited me in Stockholm, they visited my laboratory, and then we are getting along. And I think it's very important, especially after the rumors I heard yesterday about FDA sticking their fingers over the border to Mexico, that you really people try to bridge alternative medicine to mainstream medicine, because it's possible. Yesterday I had an amazing experience when I was sitting by the computerized acupuncture machine, and he was going through the list of metals which I supposedly shouldn't or should react. He didn't know anything about me. He didn't know if I removed my amalgams, whatever. And what he did pinpoint was metal mercury. Well, this is not usually a thing which you would think you would react if you have problems. But as a matter of fact, the metal mercury is the only metal I am strongly sensitized against. Well, what it tells you is that maybe, and what he further on went on, it's he localized the locus where the inflammation is to my wisdom teeth. And I know that I should get them away. And I had amalgamed, and there is a mercury there, which is transformed to metal mercury, and obviously creating sensitization, which I can pick up on memory cells. This just shows you that you should really look for the tools which are already now available, which are accepted by mainstream medicine, and back up and find mechanisms and the way to apply to alternative medicine devices. And it's, besides of pleasure to share with you my studies on metal sensitivity testing, I think this would be probably a message I would give you. Please try to correlate and do parallel studies with accepted methods. There are some available, and methods which are still not accepted in alternative medicine. And by this way, you can sell the whole message. When I can talk about myself, I am immunologist. I am born in Prague. In 1969, I came over to Sweden because I realized that I can't go on with my research and with my life under the Communist Party. And I was privileged to work at Stockholm's University and make my associate professorship in immunology at Stockholm's University. Is it better? Yeah, okay. And after that, I sort of became bored with basic research in immunology. It's too much, yeah. Okay. And at that time, sorry?
One is for the recording. The small one's for the recording.
So I will keep that. Okay. I try to think to handle all this technique. It's not easy for me. It's not easy for girls. So. Well, I think I fall dead. No, it's too expensive. No. Okay, let's go on. Let's go.
There's
I
a
need.
clip there, if you have a pocket or...
No, I don't. Maybe here.
Oh, okay, if it's not too bulky.
Yeah, that's what I think. Maybe it falls down. So. Well, these things are not made for women, as you see. This is still some way to go for who is going to decide some rows with something in it, for women speakers. I'm just one. Okay, it was just more intermezzo. Well, we still have some way to go. Okay, so 1979 there was an opening at pharmaceutical company Astra, and you know the Astra because everybody used their xylocaine. It's still working very well, isn't it? And what they got in trouble was actually their bestseller at present. It's called Losec. It's a ulcer drug, and they wanted to have immunologists to find out if the drug is causing problems in men. It was autoimmune problem, or if it was something else. And for that, they wanted to have immunotoxicologists. Well, I was just thinking, well, I'm fed up with this all basic theoretically laboratory work. I would like to use my knowledge to do something practical. So I applied for that and I got it. And it's just happened that I saved the drug, which now makes 20 million Swedish crowns a year. It just happened. I didn't know that my input in that was leading to that. But Astra is now climbing to be really big because of the progress which was saved by knowledge in immunotoxicology, which made good PR for the discipline. And I sort of started to realize that to be able to screen and find and diagnose immunologically mediated side effects of chemicals, drugs, metals, or whatsoever, you have to look at man. Because of genetics and because of that we still do not know the mechanisms behind autoimmunity and allergy, we can't devise proper animal systems to study that. And that's why I turned to occupationally exposed people 1981 when I was asked about to develop screening methods which Astra could use to find if their drugs will produce some side effects of immunological character. I just want to tell you that because otherwise it's very difficult to realize why I, working at Astra, are actually here. But the reason for that is that I was asked to develop predictive tests. And we started with that, and we published a couple of papers which you can have references to. It dealt mainly with allergy to drugs and low molecular chemicals. I have published these things. And what we have done is that we just use the very own knowledge and completely acknowledge and known knowledge that if you have allergy or even if you have autoimmunity, you have immunocompetent cells in your body, namely T lymphocytes, which will remember the structure to which they were sensitized once. And they are long-life lymphocytes, they are in the body, and now we can start maybe to look at them. Could you put on first slide, Jenny? And maybe we could switch lights a little bit. Is there anything to pinpoint with? Do we have anything?
One on the end, maybe. The black pin, maybe.
Maybe one, yes. Squeeze that. Can you squeeze that somehow? Yeah, there is something, yeah.
just push-
Yes,
just
I
push
just
the-
push it, okay.
Push the thumb, you can push it.
Push the red one?
Little hook. No, you just push the little
This
the
one?
thing that you put on your. You push that. Push the clip. Just push the clip.
Oh, this clip. Okay, I see that.
And point it toward the screen.
Yeah, okay. So, if we get to the first slide here, so we will see the lymphocyte. So it's stuck, it falls down. Well, you just get them out. Mm. Yeah. Okay, this is just to remind you what I already said, that allergy and autoimmunity, which many of distinct speakers talked about before in this impressive seminar we are attending, are subjects which are studied by immunotoxicology. And this is a well-established discipline by mainstream medicine. So it's nothing which is controversial. I already thank you very much. So it's nothing controversial about that. It's realized, and it's also, you know, the fact that there is Society of Environmental Medicine, both in England and in America, and it's actually no problem with that. So, I was talking about lymphoid system, which consists of different key cells, and I was talking about T lymphocytes, and memory cells, which you see here are depicted on morphological slides. They are easily available because you can just draw them and isolate them from the blood, and they are also widely used by Jeff is using, for example, that for testing and for studying. The principle of stimulation of lymphocytes, if it's exposed by to allergenic or antigenic agents, it's that it proliferates, it stimulates, it creates so-called lymphoblasts, and then these lymphoblasts, either T or B cells, can perform enormous array of different damaging problems. It's not just that it causes just damage, of course. We know that if we do not have them, if we get AIDS or some immunosuppression, then we are in troubles. So originally and still the main reason for existence of those is, of course, to protect us against foreign invaders, bacteria or viruses. It just happens so that modern man, because of his style of living, troubled lymphoid system with very many artificial substances, chemicals, metals, and for those cells of immune systems which are detoxifying cells, monocytes or macrophages, scavenger cells which try to clean our systems, they do not have any enzymes to detoxify or dilute or digest these foreign substances. It was just not planned that we should be robots. We are not. So, even so, it can, under usual condition, perform cleaning up of cancer cells or bacteria or viruses. If you block the cleaning system with chemicals, it can't do that. And then you have these noxious things present in the body, and lymphocytes starts to be sensitized, and then you have this what we called about chemical sensitivity. This is one of the pathways. There is another one which Gary Strong talked yesterday about the biochemical pathway, which is of course very important too. I will stick myself to the immunological part today, but you shouldn't forget that there is another part too. It's very complicated. Next one, please. Just to remind you that you have lymph node network and that you have lymph nodes which are actually all over the body. And why I say that is that you should realize that around the teeth you have very, very many lymph nodes, small lymphoid organs, which contains all key cells of immune system. And very often, and of course people who work with neurotherapy and biological dentistry know that you have to clean up these things, or you have to stimulate them to be able to properly detoxify. This is just to remind you that memory cells and T cells are extremely specific. What I will demonstrate that is that if you look on mercurius, which are actually on the top keynote subject of this seminar, we have actually no cross reactions between organic and inorganic mercurius, which is a fact which is known also by mainstream medicine, namely in skin testing. It's published, and it's also in the series of patch testing. You know that there used to be phenylmercury and ethyl mercury and inorganic mercury, and that's because they do not cross-react. There is one exception which we did find, and this is partly cross-reaction between metal and ethyl mercury. And the reason for that is, of course, that they are structurally quite similar. They are two aliphatic change. Next one. Yeah, we have it. And here you see the unfortunate macrophage filled out with chromium this time, and this is from culture. And what's amazing on that is that if you have non-toxic, relatively non-toxic metals, or you can call it biocompatible metals maybe, like titanium, you can use titanium dioxide, then, or chromium, as in this case, what you will see that macrophages filled of these grains are existing for 5 to 7 days in culture. They are not dying. For me, it means that can happen in the body. And what it tells you is that if you have corrosion anywhere in the body, it may be wearing product from the mouth, but it can also be from your hip, and this is also published, then these macrophages are traveling along your lymph nodes and the blood full of this metallic load, and then in the knee, in the joint, if it's blood-brain barrier which is crossed, can land in your brain. And what they do there, in small veins, they will die, and the metal load will be released. Okay? So forget the electromagnetic and corrosion and oral galvanism, because these are quite short distances. Now we are talking about long distances in the body. Active transport, not now by a retrograde export, but by cells which supposedly should clean up, and they do. They take the metal and they travel with it. There is just one problem: they can't get rid of it. Diamonds are forever, metals are forever. Maybe we could go to sauna, that's the only way. But this is very important, because I haven't seen that point out properly in literature, this one. Because people who are evaluated metal reactivity versus organisms are usually not immunologists. And this is the part of the reason for controversy about amalgam and metal still exists. Because all evaluations which are done by toxicologists, not by immunologists or immunotoxicologists. Next. Well, to remind you again that phagocytes, as I just told you, are all over the body. It's not like that they are just in the blood. They go from the blood to the brain. They can be there, and these things can take over. Kupffer cells, they are in the joint, and of course they come there and they intermingle with blood monocytes and exchange all the things. So our body is full of scavengers, full of monocyte macrophages, but it doesn't help us much, does it, when they can't get rid of it. Next. The reason then what's happening when you get sensitization, and again what I'm trying to show you, there are well established data in immunology, allergology, immunotoxicology, to show you that it's possible to bridge the old things with new ones, and how I say it, to sell it to mainstream medicine, because I am absolutely sure we have to do that. We can't exist, and we don't need to exist as a sort of 6 colon somewhere in Mexico. It's not necessary, because what's happening now in Sweden, it's very interesting. They realize what America already realized, that mainstream doctors are losing their patients. Patients are not happy and they go to alternative medicine. Well, they can't allow that, can they? So their only way actually is to joint venture with alternative medicine. They realize that, because by this way they will have a control, or they think they will have a control. Partly they may. So what's happening in Sweden now is actually that we are discussing to set up a faculty of functional medicine. I think alternative medicine is little unhappy, and complementary is completely bad, but maybe functional, to improve the function would be okay. Where we could try different or the best of alternative medicine, which is of course the purpose of the clinics, which is here too, and this is one reason why I am here also, to see if we could somehow co-work. But this is a normal eczema, which is type 4 reaction, and the woman or whoever it was, it had a metal ring, and then you see the redness here. And in such people you of course can find nickel sensitivity demonstrated by skin test, or you can also have memory cells, which I am going to talk about next. Here you go backwards. This is another type of allergic reaction, well established. This is urticaria, and in this case this girl has taken a drug, penicillin, and she get ampicillin rash. Still we don't know the mechanisms really, but it seems to be that it may be immunologic reaction, not necessarily to penicillins. How many of you have had metal sensitive or metal poisoned patients who do not tolerate penicillins? Yes, yes. Do you know why? I tell you. Penicillin's major metabolite is D-penicillamine. Does it tell you something? Yes. D-penicillamine is chelator of metals. Does it tell you something? So what you do by penicillins, you actually mobilize metals. Okay? I haven't found in the literature the study, simple study, which could be performed elsewhere, maybe here, to give penicillin and measure output of metals before and after penicillin treatment. I haven't found that. It has not been done. But if you are looking in literature on side effects of D-penicillamine, so you will be surprised, because these side effects are the effects of metal poisoning. It's the same. It's the same with rheumatoid arthritis. It's quite used for treatment of rheumatoid arthritis, D-penicillamine, and also it's used for treatment of multiple sclerosis. And there is quite high prevalence of side effects, that's why it's not used. And if you look on side effects, you will see that they are completely compatible with mobilization of metals and allergic response of the individual to metals. Okay? So again, I would like to perform such study if somebody would be interested, and if somebody is still using penicillamine, because in Sweden it's not many people using that because of side effects. But on another international program in which I am involved, it's a program which is sponsored by European communities. There we have developmental screening test for drug allergy, and penicillamine is one of the model drugs which is causing autoimmunity. So I would be very interested if somebody would like to do some things, we could do that. But I think it's very important, this one. So not everybody who does not tolerate penicillin is penicillin sensitive. And it gives you indication of metal sensitivity. Okay, next. This lady didn't fight with her husband the day before. She's a cleaner at my laboratory, and she came to me in the morning, and I didn't dare ask what's happened, but she said, well, then I asked her, say, hey, what's happened? What's going on? And she said, well, I got this whole stuff today. And she said, edema and whatever is there. And I said, what did you do yesterday? She said, no, nothing. I just been at the dentist. Dentist. What did he do? Well, actually, I don't know. Well, isn't that usually? You come to the dentist as a patient, you open your mouth, then you go away. I mean, you never question what dentists do. They do whatever they don't. Excuse me, but that's the hard facts. So I said, well, let's check it up. Let's see if you have any sensitivity. So we draw the blood, and we found out that she is reacting to gold. So I told her nothing. I said, go back to dentist and ask her what she has done, and she can write it on a piece of paper. So she went to the dentist and started to inquire what the dentist has done. It was a female dentist. And the dentist said, oh no, because she already knew about amalgam. So she said, oh no, I didn't touch your amalgam. The only thing I did was to polish your gold crown. Well, this is the reason of her clinical reaction, edema induced by gold. Okay? So, positive provocation test, I call it when you talk to allergologists. Again, very easy to sell whole story to allergologists. Dental treatment, visit at the dentist, and reaction after 2 days, because it's type 4 reaction. It's positive provocation test. Everybody understand that. If you can show that there is an allergenic reactivity in the patient, it's okay. Next one. Well, a little bit immunology, and why I trouble you with that is that I just want to remind you the fact which has already been told here, that we are not equal. We have different genes. Meaning that some people will tolerate their amalgams. Tolerate, I mean, they may not be completely happy with that, but they will not be sick, and definitely they will not be allergic. And other people will get in troubles. Some will get in trouble very early, and here are these Bill Race bottles, or how you call it. You are born with small tongue or a bigger one, depending on your genes. And what immunologists say is that it's so-called MHC, major histocompatibility complex antigens, which are decisive one if you will react to different things in a negative way, allergic way. Again, it's completely established that in animal studies that depending on the genes you may develop different problems or you may not. So immunologists know that for 20 years. And actually in international program I am co-working with, we have at least 5 distinct groups which have been working with autoimmunity induced my metals for 20 years. Somehow it just didn't leak up to the clinics, but the data are there, no doubt. The reason for that are specific genes which are on macrophages or monocytes or other antigen presenting cells. They may not be just those, they may be some others, but the cell which is confronted with the low molecular drug, so-called heptene, has to be presented in context of these MHC genes to be able to give a message to T helper cell, which is here. Well, I will maybe need the one from Ed. So let's see. I have too much energy. It's just inactivated. These biofeedings. T helper cell, and then of course sometimes you have the message to B cells which will produce antibodies. But I just want to tell you, in this discipline, what we are now in with metals, these usually are not present. There may be some rare situations which are in the literature about IgE-induced immunoglobulin E induced by cobalt or nickel, in cobalt or nickel-induced asthma. But these are quite old things, and they are actually not pursued further. What we know is, by studying of immunoglobulin's presence in plasmablast after in vitro induction, that both nickel and gold and palladium may get rise into B cells. But we also look on the type of antibodies which are present there, and we could find IgM and IgG, but not IgA and not IgE. And again, for mainstream allergologists, what you do need to postulate that you have problems or allergy, you do need to have IgEs. It's not enough with IgG or IgM, because these antibodies just measure exposure, but not really allergy. So this is a little warning about the presence of IgGs and taking them as evidence of immunopathological reaction, because it is not. It's not accepted again. So next please, Jenny. So this is just to tell you, if anybody is interested in references, they can have it. And just note that you have some individuals which may have metals, they may be full of metals, and still they are quite happy. They jump out and they are the ones who say, oh, it's all in your mind, you know, look at me. It's just this, that they are not immunologists, they don't know the facts. Depending on your genes, you may have either no problems, you may have or only skin sensitivity, like eczema or rash, or you are one of the unfortunates which inherited genes which are leading to autoimmunity. Again, this is not controversial, it's well established. The only problem until now was that that people were not able to do the same things in men, and this is of course clear why, because we can't perform studies on inbred men as well, unless one X, so homozygous twins. Yes?
Did you mean to say that presence of IgG or IgM antibodies to certain metals is not in fact an immunopathological event?
Yes. Yes.
And right over here you've got a mouse with a problem.
Yes.
With elevated levels of IgG complexes.
Yes. Usually you don't have complexes in the kidney, you know. It's you have to show it localized in the kidney as well. I mean, everybody have an IgG against everything, but we don't have problems against food and so on. So you have to show a little bit more than that. It may be indicative of immunological reaction, yes, but it's not enough. Yes, yes, you can. Yes, there are some, but it's discussed as polyclonal. non-specific, not as specific. The same, what you do is, for example, if you treat animals with nicotine, cigarette smoke, you will increase the IgE production. This is sort of immunomodulation. It's not really things I'm talking about just now. Okay, next please. Autoimmunity, everybody knows that, so I just want to tell you nothing controversial about that. Next. And how can metals do that? Well, nothing controversial about that either, is it? Gary told us yesterday very nicely against all enzyme systems which have SH groups. Actually, virtually any cell or any enzyme system can be affected. What's happening is, namely also, is that these metals, and it's not just mercury, it may be nickel, it may be gold, it may be palladium, will bind, and by the binding they will change autologous proteins. And the binding is very strong, meaning so the cell then, T lymphocytes, will not recognize, of course, autologous cells, but it will recognize the chain cell, which has metal on their surface. Yes?
Is there a hierarchy of order for the metals to bind with the sulfhydryl groups?
I think there is, but I would say the major offenders are very strong binders, all of them. So it's enough, binding enough. Yes?
Would it be fair to say that the sulfhydryls at the active site of enzymes would be the ones most likely to interact with this mercury?
I can't say that. I think you have very strong binding to DNA, for example, as well.
Oh, sure, but for the same reason, it's a
Yes.
pKa, it's a physical chemistry pKa local phenomenon effect in which that sulfhydryl really wants to complex with
Yes.
cations
Yes.
with a charge distribution like mercury.
Yes, very well, maybe. I don't know. Yeah?
The other part of the question, would you comment on the ability of metals that we use in the mouth to not only mercury, but the silver, the tin, the zinc, the copper, the nickel, the cobalt, the rest of those metals, how they also affect the sulfhydryl groups?
We are coming to that actually. I answer you very soon. Next one.
It's worth the price.
It's just to remind you before I answer you that as far as I can see that allergy and autoimmunity are two sides of the same coin. Systemic mental sensitivity may not be expressed just an allergy on the skin or on mucous surfaces, but it can be operating in any organ of the body because lymphocytes are circulating, and then it may not lead just to allergy but also to autoimmunity. Okay, next. Yes. Now I am going to answer the question of Ed. See where it is. Just ask you to refresh your chemistry knowledge, Mendeleev's table, and I point you a group in the middle of Mendeleev's table, which is, you know how it's called, this group? Yes. It's so-called group of transition metals. And what is common to these metals? And you see some which are used in dentistry: titanium, palladium, gold, nickel, silver, probably have two somewhere here, yeah? Or are there? Do you know what is the major property of transition metals? What are they called, transition metals? Do you know that, Ed?
No, I don't know. Maybe the valence.
Yeah, same one.
Valence? Well, it's about their status of their outer ring.
What they do, they have an incomplete electron number in the outer orbit, meaning that they are seeking this failing, lacking electron, and they do that by seeking strong binding to proteins which can give them this electron. Meaning it's not just a SH group, but they really seek everything which can give them, so they complete their outer orbit. Titanium, it's used as a catalyst. Did you know that? It's used as catalyst. It's not inert. Definitely not. Again, meaning that it's lack of knowledge, which somehow led us to this story about biocompatibility and all these things. Yes?
Nickel also
Yes, of course.
is
Yes.
a catalyst.
Oh yes, and palladium.
And
Palladium is used in breast implants,
Right.
silicone, as a catalyst. Yes. So that's what you use as inert materials in the mouse. Isn't that strange?
Platinum's a catalyst too, of course.
Yeah. Yes. Silver. Yeah. Yeah. That's it. Yeah.
It should also be mentioned that as these things go across the chart, they go back into the lower regions to build a complement. The outermost reactive electrons are virtually identical in every one, and so they will go to the same binding site.
Yeah. Yeah. Sure. So definitely, I don't see anything inert in those. Yeah.
Since you have this lovely chart up, if we look just to the right of the transition metals, where there's, mercury, and then just above it cadmium, and just above it zinc, would you like to say anything about zinc status in relation to the chance of uptake or the facilitated uptake of cadmium and mercury in exposed people?
I don't know anything, but Jonathan Wright pointed to me that they have very close. They can change each other. So if you have a lot of metals, you will be low in zinc, and the same cadmium, because they have sort of properties. So definitely zinc, lower zinc indicate metal toxicity and load of metals.
And low zinc facilitates uptake
Yeah.
of the toxic metals.
Yeah.
So
Sure.
both sides, you can reduce the toxic burden by pushing the zinc in when it's deficient, and if the person is deficient in zinc, that will make them much more at risk for the same exposure in a population.
Yeah. So zinc is quite indicative, I would say, about that. It's good to know chemistry. You know, it's stable and it's there. You can look it up, but one should look it up. People just don't do that. So let's go in our show. I stop this.
What is the significance of tin in all of this?
Of what?
Tin.
Sorry.
Tin,
Tin.
stannous.
Stannous. What do you mean significance?
Where does that,
You want to look it at where it is?
I saw where it is.
Yeah.
How does that fit into your rubric as far as reactivity of the body?
Well, the only thing I can tell you about tin is our experience with people's sensitivity against tin, and then the fact that organotin compounds are very toxic. So, inorganic tin seems to be okay, but it's not okay, it corrodes. It corrodes very quickly from amalgam. We do not find many people who are sensitive to tin. We do not find many people, and we do not find the difference between sick and healthy people with regards to prevalency of tan-sensitive lymphocytes. But we know that it's very toxic and it corrodes very quickly. Yes?
Does anyone remember HPA-23, the miracle AIDS cure from the Pasteur Institute some years ago that petered out, but it looked very promising? It was a tin complex. And in tin deficient people, the immune system is less functional, including especially cell-mediated immunity, and so you get opportunistic infections and AIDS-like complications. But hypersensitivity to the HPA-23 made the autoimmunity of the overriding condition of AIDS much worse, and they had to stop the HPA-23 because it was so reactive.
Okay. No, I didn't. I was not aware of that.
Yeah, that's a good one, Tanya.
Okay. Can we go further? Yeah. How are we exposed? Just very briefly. because time is passing, and I think I sort of didn't expect the appearance of the man behind, so I was, taking it slowly. So that means you have to wait with your lecture, now. You have to blame yourself, and I'm not sure I give you any time, actually.
I want you to interrupt me.
Good. Okay, let's go on. As far as you enjoy yourself, it's okay. well, I just want to point you that, as somebody already told yesterday, it's not that the load is starting when you are born. The load is starting at the day of conception. And it just shows you that that cigarettes and cigar are really the bad offenders, because they, besides of all cancerogenic agents, they do also have lead, cadmium, and nickel. And what we have done is that we taken cord blood lymphocytes from just children entering the world. And I can assure you, poor creatures, some of them are already sensitized to nickel, cadmium, and lead due to their mothers. So, if you want to do something for health, please tell that neither passive or active sowing should be allowed. Thimerosal, I hope in this distinctive group, everybody knows what thimerosal is. Everybody knows? It's always the same. Well, when I was teaching for doctors in Denver, nobody did, and they didn't even knew what silver amalgam contains. This you do know. Well, thimerosal is ethyl mercury thiosalicylate, meaning it's organic mercury, which is highly toxic. It's so toxic, so it's generously used as a conservant for pharmaceutical, contact lenses, presence-wetting agents, vaccines, etc., etc. When you talk to the doctor and try to realize that they are putting dangerous substances into the children, they say, "Oh, but it's so tiny. It's so tiny." Well, that's exactly what chronic low-dose exposure is. Tiny, tiny, but chronic all the time. And this is what's happening, and the data in literature show you that about 16% of kids 16, 18 years old were sensitive or patch test positive to ethyl mercury salicylate in Sweden, in Scandinavia. It's quite a lot, 16%. If you put on the top of that 12% to nickel, you have 24. And the new data on palladium, it's 8% from Vienna, and it's 12% for gold. Reaching up far-reaching consequences, telling you that nearly 50 or more of population may be metal sensitive. And this is exactly what we do see in our data. And there were also data yesterday, we were looking at cancer and so on and so on. Metal exhaust, digest diesel from the cars, palladium, cosmetics, which are exposing generously women to metallic coloring agents like lead in lipstick, cadmium in lipstick, phenyl mercury and ammoniated mercury in eye devices, mascara, which for me is the fact why women are most often coming to your dental and physician practices, because they are low dose chronically exposed to metals through cosmetics daily, okay? Very important. And you look on Jenny there, and she can tell you a little bit more. There is no cosmetics for her. She saves a lot of money, because when she used that, she had very bad skin, and then she turned out to be positive to mercury in MELISA, and that was that. Since that, nice skin and no mercury. And gold, palladium, and whatever. Please, next time. This we will skip. I just want to point you out again what I already stressed, that immunological effects are caused by lower doses. They occur at the chronic exposure. They have higher specificity, no dose-response relationship for induction, and higher genetic influence. And toxicology, we will not go into that because we are not toxicologists. Next, please. We are very fortunate in Sweden that food industry is completely ignorant of the facts that metals may be dangerous to your life, and I think your food industry the same, and control agencies as well, showing that E numbers, which you very often see in Europe at least as food colorings, are actually hidden metals. Did you know that? Yeah, good. Titanium dioxide, aluminium, silver, gold. What are we going to do against that? I don't know. I try to persuade my factory to get rid of whitish coloring on majority of their pharmaceutical products, pills. Until now, I didn't succeed. They told me, "Oh, it's just little evidence." I say, "Well, it's titanium, it's catalyst, and it's no good to give it to CNS patient, depressed patient, year after year after year after year. You will clog all their macrophages. Of course you will." But yesterday again, we listened to this enzyme therapy, and I assure you, this WOB enzyme is full of red stuff. It's used for cancer patients. Well, it's not just teeth, is it? There are many, many things we have to be aware of. And I'm always telling my students, my children, my friends, nobody takes care about you. You have to do it on yourself. You have to be your detective, okay? Then it's okay. Next.
Do we have an overhead here?
Yes, we do have an overhead, very quick overhead here. And it tells you about cross reactions against metals. All these things. I already told you. No, there are no cross reactions, even though that metals are very chemically similar in their structures. There is no cross reaction, just showing you beauty of the specifically of immune system and sophistication. And this metal and ethyl mercury partial cross reaction. Yes, next. Yes. Yes. Oh yes. Yes. Oh yes. 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 Just to remind you what I told you, different things. Ethyl mercury has many names: thimerosal, thimerosal, mertiolate, and so on and so on. Two epitopes: ethyl mercury thiosalicylate. So that means one epitope is salicylate and another one is ethyl mercury. It's two different epitopes, meaning that not everybody who is patch test positive to thimerosal will be sensitive to ethyl mercury. With MELISA we can test both. Next. It's just that inorganic mercury, it was already taken up yesterday, may be transformed in the body by profactors, which are bacteria, Streptococcus and Clostridium, which will then lead to highly toxic methyl mercury. This is a substance I am reacting to. I don't react to the fact which is also neglected by mainstream, and they really try hard to say it's not true, but it's true. And we pick up specific sensitization to methyl mercury, so we can prove that. Next. Well, what this is going to tell you, when I started to study cross-reactivity against organomercurials, I became aware of the fact that there is one substance which is called thimerphonate, which is used as a conservative for a vaccine against, which is given to Rh negative women postpartus in Sweden. It's so-called anti-D immunoglobulin. And this immunoglobulin, which is given postpartus to women who are just starting to lactate, it's used in 10 times more concentration than all others. So you can imagine it's a depot which is leaking up into these poor, unfortunate women. In Sweden, it's produced in Germany by Behringwerke, and I want to get a pass of it because it's very similar to thimerosal. It's called thimerphonate. So what I asked a friend of mine to get me a piece, and I just want to show you how this was handled when it came. Wasn't that nice? It was just 100 milligram of the poison which is injected into lactating women. Okay, next. Well, it's funny, but it's not funny, it's tragedy. Yeah. Next, please. And next. Okay. Showing again that we are playing the hazardous play, and it's not just dentists to blame, as far as I can see. Dentists very often are people who are very, very concerned about their patients and do everything, and they will be the one who will lead the pathway to metal-free physicians and so on.
Are you saying that dose is what's injected into a...
No, not this dose, no, not this dose, but the same agents. And quite high dose, yes. 10 times more than, yeah.
You can get 10 milligrams in a ROGAM injection. You can get 10 milligrams. Not 100 milligrams, but 10 milligrams. Too much. Much too much.
Yeah, much too much, yes. Next. Teeth. Let's get to teeth and realize this is Australia, and now they formed IOMT in Australia. In February there will be meeting. I am going there and lecture. If anybody is interested to get more information, Mari Vimy is coming there too. So there will be big. This one is from 2 or 3 years ago. Shows you the corrosion and the contact with lympha and with blood and disseminating all these products from the teeth over the whole body. Next. And this is from Jenny's famous article, Beware of Metals, Possible Cause of Immunological Diseases, as nice macrophage, in that case titanium oxide, which is completely biocompatible. This poor fellow is still alive, but guess if he can do anything else than carry titanium oxide. It can't, of course. So they are compromised, strongly compromised, and we are looking now on women who developed human adjuvant disease after breast transplant with silicone, and we do actually find macrophages compromised with silicone. And we are measuring phagocytosis, and we are looking on epitopes now, if we see if we can dissociate. Next. Stuck? No. Very quickly, things which you know, that's where I started about 5-6 years ago, when I started to develop the test by which we could objectively show the reaction of the body against metals. And this is oerlikon planus near amalgam fillings, and if you remove amalgams, this will go away. According to Swedish regulatory agencies and Swedish physicians organization, this is the only effect amalgam has on the body. It's so-called local allergic reaction. Imagine, local allergic reaction. Allergy is systemic, isn't it? It's nothing like local allergic reaction. But anyway, the only people who can get free removal, replacements of amalgam in Sweden and elsewhere are the people who has these whitish changes. Very often, of course, they don't, because it's immunosuppression in the oral cavity, so you don't have it there. So that's too bad. All the rest is not acknowledged, but all data are there to show them. The same is with gold. Of course, you may have the gold, which will do the same. And as you already noticed, gold is not gold. Gold may be 5 to 2 different components, from tin to palladium to iridium to 10 to whatever. And when you talk to people at the odontological high school, so they say, oh, well, we know that sometimes, you know, technicians, they take a gold, they put in some nickel. You know, it's very, very, very frequent. I knew also, and I don't know if anybody has some hard data, is that in copper amalgam, they are rests of nickel, and the reason for that is that you can't get rid of that. If you produce pure copper, you have to have some nickel. If this is true, if we could find that it would help us to prohibit amalgam, because anybody knows, and European communities are now preparing hard, strict control of nickel producing nickel containing products, because nickel is acknowledged allergen. So if we could find in copper containing amalgam some traces of nickel, this would do the thing. So this is again one way which you could start on. Please go on, Jenny. You know what that is? Who guess what is that? It's a skin test. It's skin test with metals. It's on the back. This is the only test available in Europe at present for diagnosis of metal allergy, type 4 reaction. It tells you, of course, what it does. It re-stimulates the immune system. These patients, not only that they have local problems, they very often have systemic problems. They can be bedridden for 2-3 weeks. Even though insurance company will take this as the only test until now. MELISA, it started to be accepted, but as the only test to prove allergy to metals. There is one thing which is difficult besides of clinical effects of recall, and this is if you have toxic or irritative substances like mercury, then you will of course have difficulties to dissociate between toxic and allergic reactions. Okay? So it's quite bad tool, but still it's used because there is nothing else, and so on and so on. Next. That's why we started and developed this MELISA test, which stands for memory lymphocytes. I will not go why this is different from a normal lymphocyte transformation test. I will just go very quickly over to the procedure. Next, Jenny. And principle of this immunoassay based on the fact which is well known. As I already told you, sensitized lymphocyte and antigens will clonally expand the number of cells with receptors for this antigen. The number of memory cells at the beginning in the blood is rather low. It's about 1 cell in 100,000 cells, while after 5 days cultivation in vitro, it will be 1 cell in 100 cells, meaning that it's at the detection limit and then you can find it. Next. Take this blood, isopod, little bit tricks and so on, and then screening plates. These are macroplates, not microplates, 48 weld plates, 1 million cells per milliliter. You need to have pretty lot of cells to be able to pick up these starting cells. And then after 5 days, you obviate it by thymidine incorporation and by microscope. It's quite sophisticated. It's nothing which you can do on the batch, I agree. The reason for that is that in a standard transformation set, you get into problems due to stimulated macrophages, which will incorporate your thymidine and which will make problems in your correlation and in your results. So that's how it is. It's patent in Sweden, it's European patent, it's patented in America. Very quickly, metal-free dental nurses which are not reacting. What you see here is lymphocyte proliferation as stimulation index, and for you who are not immunologists, just to say that about this level everything is positive. That means lymphocytes have been there with the proper receptors and they did not divide. That means we did not have these large cells which incorporated thymidine. So that's why it's low. And these are dose response curves. We always run at the beginning the many different concentrations. It's very important because there is individual sense specificity and responsiveness, and these phenylmethyl and or other are very irritating, toxic, meaning that you have to have a proper optimal concentration to pick up the possible responses. Very important. Next. Another one, this is dental nurse with amalgam, and again complete non-responsiveness. The immunologist in the audience knows that there is still a dogma which actually allowed me to get a patent which claims that that mercury is polyclonal nitrogen. It's definitely not. You can see that there is no way, there is not a single cell which is left. And the reason why is that it's desensitization. It must be that people who will tolerate amalgam, the dentist of course, by daily exposure they get rid of cells which could react to mercury. So they don't. They made it. They made a peace with that. It's again accepted theory behind tolerance is desensitization. So you can sell that to allergologists. Next. This is now a female exposed to thimerosal containing vaccine at work, and she has chronic fatigue. And I will not go into that. I just want you to know that in that case she is responding to thimerosal, to thimerphonate, and to which one is that? Ethyl mercury, which is epitope of thimerosal, while there is no cross reaction to phenylmercury and to inorganic mercury and part reaction to metal mercury. She's now removing her fillings and she's feeling better. Next. And this is a person with oral lichen due to gold, and then we have control patients who can tolerate gold earrings and tolerate dental golds, are healthy, and dose response curves to gold thiosulfate. When we run MELISA, we usually are in region 6 down, because we do have some control people who seemingly have no problems with gold, but they have memory cells above the range of 6 here in this upper level. So that's be precautious, and to be able to correlate the responses in MELISA to clinical signs, we are at a level here. Next.
I think it's overhead there.
It's overhead, and what it's telling me. Maybe you can put on.
Is it or not?
I don't think so. Maybe it fall down.
Okay, next slide.
Yes. Take one another slide. I think it fall down. Yes. Okay. So we can. I'm now going to talk about chronic fatigue, because time is going, and we will not be helped much by case reports unless in practice, of course. Everybody knows that mainstream medicine will not accept case reports, which is bad, but that's the facts are, because we learn a lot on case reports. So that's the reason why we initiate very defined studies on chronic fatigue, which I will report on you. I just go through few case reports showing you how the data are generated. We do have an inquiry, which is available here, which will give us exposure from different rules. And then we run the test, and in this test, the person is also patch test positive to gold and nickel, which is here. Nickel is not tested. Palladium, people are usually not tested to palladium. It tolerates 10 copper, but it's positive to mercury and slight reaction to titanium. During these people are usually treated by antioxidants, mineral vitamins, and then their metals are of course removed. And I will show the data what's happened after that. I think we go quickly through these cases because we don't have time. Just we go over that very quickly. Case report. This is person with chronic fatigue. 22 amalgam fillings, gold crowns. This is porcelain ceramics, metal ceramic, and again a porcelain crown here in these things. The guy contacted me, and he was 28 years old, and say, "Hey Vera, if you are not taking me, I am committing suicide, because doctors told me I have to live with it." He was tired since 15 years of his age, and well, nobody could help him. All laboratory tests were of course normal, as they always are. So what started now was that he responded to tin and palladium. He is one of few people who actually responds to tin, but not to mercury. There was slight reactivity to thimerosal. There are two different maximal concentration of metal, giving the optimal proliferation in vitro, which are depicted here. So that was the thing. So we say, oh, hey, you have to get rid of all the garbage you have in your mouth. Next. And this is what our dentist did. All amalgam fillings removed. He ate vitamins, minerals first 3 months, and then they got all amalgams on 3 occasions. He got new plastic fillings. Then he removed his crowns, changed to temporary crowns, and then he got new porcelain crowns. Then he removed this, and he gave him permanent bridge, this position. Everything nice, yes? And this is just to show you what he had: gold, platinum, palladium, silver, tin, indium. Do you realize that? It's not just that it's so many metals. Every new dentist will give him something else. Please, if you use gold, stick to one and check one which the guy has and put the same one. Yes?
The dentist can legally state that the crown contains gold if it contains as much as 2%.
Sorry,
In other words, the dentist can say it's a gold crown if it has a minimum of 2%
Oh, really?
gold.
Is
So
that
he's not
nice?
a liar.
This is incredible. Well, you should really ask the ones who are supplying you to get a list. I mean, this is the only way, because this is really crime. This is crime for me. Yeah, next. After that, striking thing happened. The guy started to read better and better, and this is about a year after. It's 91, so it's some old time. But this disappeared. Next. This diminished. We will not go into that. We know everybody that. And he at that time had still some problems. But he is healthy, he works now, and he's definitely not taking suicide anymore. So it just tells you that you really have in your hands treatment. And this is why I think it's so opposed by medical people, because they realize that they may not be the ones who will treat the patients. It will be dentists. And you realize what it means. I mean, physicians are gods. Yeah, gods. So, yeah. Yes, we do have on gold pretty good, and palladium, if it's performed properly. Right. That means you have to have it in petroleum and things, you know. Many allergologists don't do proper thing. Yes, yes, yes it is. Yes it is. Yes, yes.
Some of these substances were placed in his mouth post-op were have barium and other metals that are also reactive. Do you have any test for that?
Yes, yes. We did screen, yes. Oh yes, and this one negative. So I show just the positive ones. Yeah, sure. Okay, next. This is the follow-up MELISA, which was done a year after, and you can see the reactivity is still there, but it's going down. It shows clinical relevance of the test. Very often you can't do it because you still have some metal there, or memory cells are, of course, long-time survivors, so you can't expect that they will go down. But in a while they will. Yes, they will. Yes. Chronic fatigue. Now we come. Increasing group of patients which mainstream can't do anything. They are very puzzled, they are frustrated because they don't have any chance. When I thought which group I should choose for this study, I took this one because obviously Astra has no pill for that, like anybody else. I just didn't want to compete with my company, which anyway paid for all these things, more or less. They allowed me to do that. I mean, so I am not ungrateful. I told you how the autoimmunity could affect and the mechanisms behind. I just get through the results very quickly here. Yeah.
We have 2 overheads.
Yes, we have some overhands. Very good. You remind me. These are selection criteria here for chronic fatigue, and these are changing all the time. But regardless of that, the diagnosis gained the ground, I would say. 3 or 4 years ago, there was nothing like chronic fatigue. Now it's definite entity. This is from 91, and we have just next week, I think we have symposium in Sweden on chronic fatigue, where the eminent researcher from America, for example, Kosowski, is invited. But there is a nice story about that. I am not invited. No?
Were you uninvited?
Yes, I am invited. So I call the guy which I know and say, hey, I have one of the best studies, whatever, on chronic fatigue. Shouldn't I get some time? Oh, we don't know. This is actually not scientific meeting, he said to me. It's just definitions and so. So, well, I seen Kosowski and so. Okay, so I finally got invitation, but I didn't get time to speak. See? That's Sweden. But I suppose so. We have to go through America. Usually the way how to do it is like that. But it's true. Little Sweden is always looking for Big Brother, you know, and when Big Brother comes, then well, it's funny, isn't it? Yes. Yes. Yeah, you never profit in your own home. These are 95 statisticians which we have in our group, has done 95% confidence intervals for the difference between chronic fatigue and controls in a prevalency of responses to different metals. And as I learned, the one which are above the 0 are the one which are positive or significant differences among the control group and chronic fatigue group. I will tell you more about it. You can go on, Jenny, a little bit now. Yeah, this is just this mitochondria stuff which you shouldn't forget also about the energy and all these things, but we heard about it yesterday. And this is, we also told, go away. And this we pass again. These are the few things which do have. Chronic fatigue rehabilitation projects run with University of Uppsala clinicians, which I like very much. Antti Danason, clinical immunologist who recovered from progressive multiple sclerosis himself, and Anders Lindvall, and then we have a dentist, then we have a statistician, and my group. Yes?
Do you have more overheads here?
Yes, but maybe we could show some data on the study first. 97 consecutive patients remitted to Uppsala amalgam clinics, mean age 47 years, prevalency of females according to males, and 77 so-called healthy subjects. So-called healthy subjects, I will now go into that. My included, mean age 46 years, 55 females, 12 males. No differences in age, slight preponderance difference in sex. That means that statistics had to be stratified for this slight difference. Next. As a good immunologist, I am aware of the facts which could sort of be criticized in this. And one of these facts is that if you want to claim the comparative immunologic sensitivity among those groups, you have to show that there are no differences in spontaneous control proliferation and in proliferation to another unrelated antigen, in this case BPD, which is tuberculin. Everybody in Sweden is sensitized more or less against that, and there were no differences really. Everything good, okay. Next. Yes, this is the noise in the healthy subjects, showing that there is definitely some metal sensitivity in a normal population, which is to be expected. The one which is the biggest one is nickel. We know that this is the most common offender, but we do have all other things too. We have palladium, we have about 10% on mercury, phenylmercury, we have something on titanium, ethyl mercury, of course, cymarosa, the same thing. Here here are the frequencies, yes?
You find females more sensitive to nickel than males?
Yes, yes you do.
Do you know what percentage?
No, I can't answer that. Yes?
Question.
Yes?
Where is the non-dental exposure to palladium?
Where is what?
Where is the non-dental exposure coming from?
Car exhaust catalysts in the cars.
85% is combustion catalyst
Combustions.
related.
Yes.
And also the chrome.
And
There's a
yes,
small amount
yes.
of smoking.
And jewelry.
Yes.
Yes, jewelry. Yes. Okay. Statistics. Highly significant difference among control and chronic fatigue group. That means that chronic fatigue reacts much more significantly. It's inorganic mercury, gold, palladium, phenylmercury, and metal mercury. It's significant difference between copper, silver, and thimerosal, and not significant in those two. That's what we get.
Nickel was not significant?
No, not significant. And this is due to the fact that we have so high background. Yeah, yeah,
High background.
yeah. Maybe we have, no, this is MS. Put it back. I have 2 overheads. Until now, we did just follow up now in the autumn. 64 out of these 97 patients removed their fillings, meaning that they became metal-free in oral cavity. That means they were removed not only amalgam, but also other metals like gold fillings, and they were also cleaned or removed root-filled teeth. Very important, because root-filled teeth may contain cadmium, of course, phenylmercury in N2, titanium, and all these things. So 64 had gold, 73, 11 had titanium, and 100% actually had amalgam. 100%. This is the follow-up showing that 55 out of 64 chronic fatigue improved following removal, 6 were unchanged, and 3 got worse following removal. I will not go which one didn't. Which struck me yesterday was when I looked on the data compiled from the study of IOMT about the prevalency of improval of different things after removal of amalgam, that it's actually the identical data. Isn't it amazing? But this is well-defined group which is accepted, and we have follow-up, and we have now objective evidence of the mechanism behind, which is important. This is only thing how we can again sell the whole thing to the mainstream, by using the objective test and by running proper studies. That's why I see that. Yes.
Is this published?
No, it's the first paper is published on MELISA, and I have about 17 reprints here. So for physicians who are interested, there are some handouts. This large study is not yet published, and there is another thing which is resubmitted. This is the group on amalgam-free, on Orlican and controls groups. And the problem is, it's not only that you have to do the study, you have to also get somebody who will publish that. And unfortunately, the referees and editors are mainstream editors, meaning that I got my second manuscript back 3 times, and there is no objection to the data. It's objection that they don't have a space. Okay? They don't have a space. So if you know any editor who would be courageous enough to get this in, because it proves mercury sensitization, yes, then I would be glad, because it's, you know, it's horrible. You just lose time. It's no sense. Yeah. So that's about it. Next, Jenny. No.
Look for the manuscript in a future issue of the Journal of Nutritional Medicine out of London.
Mm-hmm. Yeah. Yes, I will. Yes, I am nearly ready. We have another study which we are going to finish up, and it's a study on MS. It's 47 MS patients and the same control groups, and we do actually the same, and I will not go into that. I just tell you the content of the study is that there is highly significant difference in metal reactivity of MS patients to inorganic mercury and to phenylmercury. This is the far leading one, and then there is significance to palladium and gold as well. And we actually have clinical relevance. We have people with MS who recovered who has strong reactivity to gold, confirmed by patch testing, removal of gold filling, and recovery from MS. We also have evidence on ALS, very often metal sensitivity. MS, actually nearly 100% of patients will react to nickel. You can find it out just asking if they tolerate earrings, and you will see what they say. I have just few more things left. Jenny, MS patients, that's what I told you, 60-70% nickel, and those 10 in the controls. Cadmium, titanium, I don't know really what to do with it yet because there are no skin tests available. What I know is that these people has root fillings and they have cadmium exposure. So it may be because of the agents, but I don't have any bridge onto clinics because these tests are non-existent test for that. And for lead as well, titanium, they try to use skin testing, but it's not soluble, so you will never get any positive on titanium. And silicone, of course, it doesn't work. Next. This is a 36-year-old truck driver, one of them which we followed and actually rehabilitated, exposed to amalgam, gold bridges, titanium, screw post, and 2 root fillings, and 2 contained phenylmercury. Following the dental treatments, he got polishing his golden crowns, he got urticaria on the arms and relapse. Okay. For me, showing that there is a clinical relevance of these findings. Then we also did analysis of his fillings and found that it contains nickel, palladium, and cadmium. Yes?
Were the MS diagnoses correlated with MRI studies?
Yes. There is a paper submitted now on together with Lita Tibling, which is a professor ENT in Linköping. And there she has looked on 100 healthy, so-called amalgam beers and 50 so-called metal poison patients. And she can see definite changes in basal ganglia by MRI, which indicates the deposition of metal in basal ganglia. And the same study, we have looked on both phenotypes of lymphocytes, and we see dysregulation of phenotypes, and we also see that majority have memory cells against different metals. So this study is also now resubmitted, it has been rejected, and again it has to be found somebody. And there are objective data by MRI showing that metal poison people have definite changes in their head. Also, yes?
We have about 5 more minutes if you want to mention a little bit about the silicone problem.
Yes.
You want to go through these?
Just through it and put the last one. Yes. Yes, that's all the same. We have cerebral vasculitis. We have, very strong reactivity to lead, cadmium, mercury. Yes. Yes, and the motto, how do we reach our common goals? Please try to get ways to mainstream medicine, spread knowledge, experience, cooperate, and last but not least, which you all do because you are here, you use your common sense. So I just want to tell a little bit about my study together with Karolinska Institute now, plastic surgery at Karolinska Institute. And it has been initiated in Jacuzzi in Palm Springs on the meeting of functional medicine. When I came there first day, tired after I was invited speaker by Jeffrey Bland, and I went to Jacuzzi, and there was a mat sitting in Jacuzzi. It was dark, beautiful, you know. And I just slipped into jacuzzi, and he didn't say a thing, and I didn't say a thing. And then he said, "Where are you from?" And I said, "Well, I am from Sweden, you know." He said, "And are you on holidays?" I said, "No, it's convention." And he said, "Well, on what?" And I said, "Well, on metals and effect on immune system." And then he didn't say anything for about 2-3 minutes. And then he said, "You know, me and you may have quite a few things in common. I am mainly the person who works for the rights of thick women who got silicone breasts and developed adjuvant disease. The man was Henry Jenny, who was living in Rancho Mirage. He didn't know anything about conference, but he told me that the symptoms of women who did not tolerate or who became sick after implants of breast, they were the same symptoms as symptoms of our patients, exactly the same. So of course, it told me immediately 2 things. One thing is that we could try to apply MELISA for finding the epitope, maybe to pre-screen before transplantation, but also afterwards, which one will react. And he told me another thing, that maybe in the group of these metal implant women, there may be some who will react to metallic devices. And this will sort of mimic the effects of the immune system on silicone, even so maybe they will tolerate it. So what happened after that was that I invited Henry to my laboratory, and he came, and at the same week, believe or not, there was an annual meeting of plastic surgeons in Örebro. So I called the guy and say, "Hey, we got Henry Jenny there." All the time mingling people. He went over there, and there were some people from Karolinska. There was this Olafur Jakobsen, who was Icelandic physician, and of course they were, they were not pleased at all. Not pleased at all, drinking beer and booing, "Oh, this is, how could you bring this guy?" and big mouth, oh my goodness. But besides of that, when this guy from Karolinska came back, he called me and said, "Hey, we would like to, this seems to be something in it, couldn't we do something together?" So we did. So I don't know, did you do some overheads? You didn't on this material? Yes. So what we did was we did a pilot study, which will now be presented on the annual meeting of medical people in Stockholm. It's a beauty of that, because Karolinska is the mecca of mainstream, and now I have people from plastic surgeon who will say what we found. And what we have found was that quite a few women who has metal implants do not react to silicone, but they do respond to the metals. What about that? Isn't that a beauty? Because I don't need to tell that. And they were sort of quite pleased. And he realized that actually it's not so strange, because we have to look on the whole. And if you want to put some plastic implant into the body, we have to make sure that we probably lower the threshold in other things, maybe in the mouth. So that means that from the person who developed adjuvant disease, you have different joint problems, you have dizziness, you have depression, you can, by screening, find out which one are strongly reacting metals to in their mouth. You can confirm that, and you can alleviate their problems without needing to operate, which sometimes it's very, very hard stress. So I don't know. I don't know.
Sodium silicate.
Sodium silicate, yeah. This is
It's the Mexican copying machine.
Mexican copying machine. You have to show the data. What we have here is attempt to try to find an epitope for silicate or for silica, which could show us which patients are really the one who react. And they definitely are some which are differing, which have very strong reactivity, while other not. We have people without symptoms, and we have also control non-transplanted patients. It's just an attempt, and I can't claim that we still got it. We are working on that. Can I have the one, if you see anything?
No, this is just...
It's the same?
It's the same.
Yeah. But we should have one with metals, no? Yes, it's with metals. MELISA with nickel, gold and palladium. And you can see here that the person who reacted to silicone has very strong reactivity to metals. We have some other. This is a person with autoimmunity. And another one here, number 12, who has very, very strong reactivity to metals. And you can also compare it with patch test, meaning for me that these would be the first one which you try to remove their fillings and lower the pressure on immune system, and then maybe they just improve and you don't need to operate, which is, I think, very, very important. It's not so simple. It's not just silicone. It's not just metal. You have to think about the whole load. This is very important. Yes? Yes, yes, and we did check for aluminium and for palladium as well, of course. And aluminium, because it's aluminium silicate, it's silicone, and we didn't find actually much on aluminium, and we didn't find on tin. No, no, they are again the same offenders: mercury, gold, palladium, nickel. And again, if you just ask your patient with silicone if they tolerate earrings, very often they say no, they don't. They don't tolerate nickel buttons. So I have inquiries in if you want to have some. Yes?
On some of the silicone patients that I've seen, there seems to be a tendency to have breakdown of the mandibles and sometimes the maxilla.
Yes.
So they have titanium implants.
Yes.
You run
Yes.
tests with titanium.
Yes, yes. These didn't trick, no. But they don't have any type of implants, those ones, no. Yes. Okay, I think I'm done.
Thank you, Joe. That was educational. We're going to take a break now, and then we're going to come back. See, Dr. Jaffe never let me down. I knew he was going to be here, and I mentioned that. I said, he may just be a little bit late. Okay. You can see the magnitude of our problem here.
Can we send blood to her to get the test done?
Yes.
We have to discuss that.
Yes, eventually. Okay, any other questions about anything? All right, let's be back at a quarter after, and we'll get started for the last program.